Nine, how's it going?
It's going well. I'm fighting through some things in the portfolio. I think we made some progress this week, so
Good.
Feeling good.
Good.
You do all this work with these companies, and it's hours, as you know, but the listeners don't always know. It's hours of like working through change and reducing costs and raising new money, and it doesn't always end in anything. And so I'm hopeful this week. I feel like we made some progress in the portfolio.
You know, just reflecting on the last 18 months, I do not expect anyone to feel sorry for venture capitalists. I don't. I get it. It's an incredible privilege to write checks. It's an incredible privilege to manage money. It's an incredible privilege to make decisions on who gets funded and who doesn't get funded. So I don't like.
Yeah, we have a great job.
Yeah, I don't expect anyone to feel bad for us. I will say there is a spectrum of VC. There are those VCs that follow party rounds, drop a check in, and don't actually do any work. For those VCs that actually are leading deals, sitting on boards, and working shoulder to shoulder with founders, this is not a glamorous job.
Right.
This shit is hard. And I think about everything from like the SVB, meltdown to the meltdown of the Series A market last year, to the down rounds. There's a big, not a big story, but Peter Walker from Carta did a whole sort of data minute thing this week about down rounds and how prevalent they were. I think it was like 30% of the investments last year on Carta were down rounds or something like that. Folks, this is not glamorous, fun stuff. This is super hard, especially when you're going through a market cycle shift.
Yeah,
like we're in the middle of right now. Funds going out of business. It's real work, and also like heavy is the crown. I mean, when you're managing this kind of money, the swings and the potential wins and losses, it's a lot. It can create a lot of anxiety. So people have to take care of themselves, and I think the pressure is not for everybody. I think 2024 we're going to see more funds just hanging it up for a variety of reasons, just saying, listen, this is no longer fun. It's too hard. It's no longer fun. And there's other ways to make money. Yeah,
that's right. And so when I have a week like this week, when I get some rays of light, it's a little hard to talk about the pod because I don't want to out particular companies, but they've been working a ton of hours trying to do more with less and negotiating. I'm trying to help them negotiate through changes in the cap table, restructuring things, trying to get it all right-sized, which can be challenging and sometimes just falls apart. It's good to see something maybe going to come together.
Yeah. All right. Got a good week of stories to talk about, so let's dig in. The S&P 500 is ripping.
Yeah. I mean, it is a record close 5 days in a row. So last Friday and then every day this week, the S&P 500 has closed at a new all-time record. And the Dow is also, I don't think it has that same streak. I think one day it didn't hit a record, but both of them are just like to the moon. And yet it feels to me like the overall economy is not taking off like that.
Well, it's the haves and the have-nots are getting more well-defined. There's more concentration for the haves. So we're hearing stories every day about the have-nots. We are seeing consistent layoffs that are driving stock prices up.
Yeah.
Right? Every time there's an announcement of layoffs, the stocks get a bump from that.
Right.
So that's part of what's going on here this week.
Yeah, both of those things, I completely agree. I just want to pull them apart a little bit. So the Magnificent Seven or whatever it is, we've done a show on it. There's very few companies in the S&P 500, 7, maybe a couple others, but less than 10 that are driving most of the gain.
Right.
The earnings across the 500 stocks are down, and it's all multiple driven.
Right.
It feels like, even though it's called the S&P 500, it really is 7 stocks. And they are the have-nots. They're all the big tech companies that are able to leverage technology to grow their power and eventually their earnings. It's a record, and we should note that, but it doesn't feel like it's flowing through to the overall economy. And then there's continued layoffs every day. There's new layoffs
multiple times a day.
Right.
Yeah. It's it's all part of the reformation of the economy. And we were going to talk about Davos. We're going to end up mostly talking about AI, I think, but just to quickly talk about how pretty uneventful it was. It's just not where the economy is being worked out anymore. It's being worked out geopolitically in technology. That's where it's all sort of coalescing. Capital markets and technology companies. That's where the economy's happening.
I think the Davos thing and the Davos man and that whole ethos, at least they have realized that they need to be a little lower key. I think that's why I was kind of quiet, because they're not flying their private jet in and then talking about climate change.
Right.
And telling me that I should, conserve. It was a lot lower key, but that meant that really there wasn't that much newsworthy that came out of it.
No.
So I think it's just a declining power in the old geopolitical world order, like U.S.-led, NATO, Europe, United States. That is declining. Not that we don't have power, but we're declining in the power. And that sort of elite group that met in Davos every year to decide the fate of the world has less power today. That's probably a good thing, but it means that there's not that much to cover out of that. So
non-healthcare related, but I'm into sports and media just through the soccer club stuff.
Yeah.
So it was announced this week that the flagship show of WWE, World Wrestling Entertainment, is going to Netflix.
Right.
And they signed a deal similar to the deal that Major League Soccer signed with Apple. So 10-year deal. Mm-hmm. The Major League Soccer deal was $2 billion. The WWE deal was $5 billion. It's been viewed as somewhere like a 25% increase on the rights for the show from the last contract that they had. But previous deals were 5-year deals. So this 10-year deal kind of locks them in over the course of 10 years to that 25% increase. So, that kind of, if you just amortize it out, cuts it down to a 12.5% increase really over 2 5-year terms, right? But the big thing about it, in addition to all the financial terms, is it's the first time that a major WWE show has moved off of cable onto streaming, and it's going to be on streaming for 10 years. So 2025 to 2034, it's going to be on Netflix. And by that point, everything's going to be streaming. Ain't going to hardly be no cable anymore, right? I think that is a sign of the shift of the Magnificent Seven, right? Because so many of the layoffs we're hearing about are old world media companies. Forbes, BuzzFeed, Business Insider was announced today. 8% for Business Insider, I think 3% for Forbes. And the streaming platforms being able to lock in these really long-term deals at fixed economics, like, to me, that just demonstrates they're accruing more and more power, because that's a fantastic leverage deal for them. And if they're able to start hollowing out cable, I mean, what part of media are they not going to be able to hollow out? They've already hollowed out the newspapers, right?
Yeah. I mean, live TV was the last place.
That was it.
And that now is over. I mean, this week, I hadn't really thought we were going to cover it, but it's great. I mean, Netflix really kind of stood up and proved they are, I think, by far the leader in streaming.
Streaming, for sure.
Their churn rate is really, really low. They're like at 2% a month. Other platforms have a huge churn rate. They're sort of burning through 60, 70, 80% of their customers every year. So they have to refill just to keep up.
Yep.
Netflix is much better run, honestly. And it looks like to me, Amazon Prime is really the competitor that has
the
the
number
staying
2.
power.
That's the number 2.
And that's because they have a whole different
It's Amazon.
They have a whole different set of resources.
It's Prime.
It's Prime. Yeah, right.
It's not a streaming platform.
No.
It's a feature of Prime membership.
Yes. Yes. I was a Prime member before they even had TV.
Exactly.
And when they got TV, like, sure, I'll take it. I'll take it. It's pretty good. So, yes, Netflix, they killed earnings. They had this big announcement, a huge live sports event. And it just seems like cable with the rest of old incumbent media is dead.
Yeah. And I mean, that's a whole nother industry that big tech is just swallowing up.
Right.
Yeah. So I mean, I think the thing to really sort of note here is, one, healthcare continues to be resilient against big tech domination and swallowing, right? I mean, big tech really is largely, and gosh, we probably should have pulled it in. Maybe we will in real time. There was an announcement from Amazon around sort of the growth of One Medical this week. So, you know, I do think there's going to be more approaches to the commercialization of healthcare through these bundles and through Prime memberships and things of that nature. But at the end of the day, fundamental healthcare is still, I mean, I think it's back to the Apple Watch story, right? It's still just got barriers on barriers that keep it protected. Whereas all these other industries, retail, media, I mean, if it's consumer facing, man, it's in trouble. It's in trouble. I think CPG is in trouble.
Yes.
I mean, you know,
definitely. I mean, if it can be digitized, it already has been, or it's being done right now. And healthcare, eventually you have to interface with the human body. You can't put it over a Wi-Fi network and shoot it across the world. Now, there's lots of aspects of healthcare that can be digitized, but that core laying hands on a patient and giving them some kind of treatment is really not that digitizable.
No.
And so healthcare is protected somewhat, but it is people are coming from all different directions, like Amazon, and they're going to keep coming. And so I think our listeners and our portfolio companies and our incumbent customers, they have the opportunity to get their act together and sort of upgrade and bring the right digital services to complement the face-to-face laying hands on a patient. But I don't think we can get sort of lazy and just expect to be protected forever.
No, we're not going to be protected forever. And I think one thing to think about are the undesirable markets, right? And how the tide turns. So, you know, a market that I would imagine most of big tech doesn't really care to do anything with today is senior care. First of all, most seniors are not that tech literate. I mean, you know, they might use Facebook, they might have an iPhone, but sort of beyond those things, I mean, I just tell you from my view of my 85-year-old parents.
Yeah, right. It's
like,
hard to get them to.
Yeah, Facebook and using their phone that's kind of where it maxes out.
Right.
You know what I mean? I'm doing a lot of stuff on their behalf when you get beyond that. And I think as technology continues to get new interfaces, right? So we have AI, we have voice, we have the metaverse. All these things are becoming a lot more real. They're getting a lot less jokey and getting a lot more real. I think it's just going to leave generations of people in the dust. Like, I mean, I know a bunch of, you know, people who are in their 60s who I don't think will make that leap. And there's probably people in their 50s who won't make the leap to the next big interface we're going to have in technology, right? So you overlay that with just the shifts that are happening in, you know, Medicare Advantage, it's becoming less desirable. And it's almost like they're just going to carve that out and say, okay, old school healthcare industry, you can have that while we focus on, you know, the millennials and the employer-based, you know, market and how we can make convenience really great and just get them all used to the way that we work so that when they get into their later years, they're a captured audience and we can better manage. And we'll take that part of the market as our focused market target ages, but not like we're not going to try to steal MA from you today.
Yeah, I think there's no question about that. I mean, we talked with Emily probably right before the turn of the year about where the senior population is demographically, and it is about to peak. I can't totally recall, but like next year or 2 years from now, it's going to peak and then be a slow decline. And yeah, I think at some level, the incumbent industry will take care of the boomers, and then there'll be new sets of services for the growth area. And so getting to this next story, Humana, they missed earnings. They had a lot of utilization, a lot of spend. Their MLR was 92. I think we covered that last week.
We did.
But then they came out this week, and you found this story, but they are going to reprice their plans because they don't expect the government to make any significant changes to the reimbursement side. So I think what they're saying is they're going to charge the seniors more.
Yeah, that's exactly what they're going to do. So let's just read a couple of quotes here. So from CEO Bruce Broussard, he says, "I think the whole industry will possibly reprice. I don't know how the industry will take this kind of increase in utilization along with regulatory changes that will persist in 2025 and 2026. So he is predicting, probably on good inside information, and I don't mean insider trading. I mean just,
he has people.
He has people who are tracking the trends of where the agencies want to go with this stuff. They're expecting more of what they saw for the 2024 rate notice coming over the next 2 years. They're seeing utilization increase because as we get to the top of the curve over the next 2 years, that's going to mean a lot more usage.
Yeah, a lot more as a percentage of seniors. More of them are older.
Yes.
More of them have acute healthcare needs and are expensive.
Right. So more usage.
Yeah.
Right. And that, managing usage that's key for MLR. You got to manage that if you want to make money, especially in something like Medicaid Advantage, where the spread is the key to making money. So they said they wanted to raise prices. So you and I had a little discussion around what are the prices like now, and
we're in the market, and we had to go look it up. I was not aware that pricing was a significant part of it.
Yeah. So we went to just to set the table for anyone who doesn't know. If you're just doing regular Medicare, that's coming directly from the government, there's no charge because the government is delivering it.
Yeah.
But if you're doing Medicare Advantage, that's generally speaking, it's going to be a private insurance company that's doing the administration of it, and they can layer on a cost there as they sort of package the different plans. And depending on what state you're in, what plan you're working with, what company, all those things factor into what the different plan options you have, as well as what the different prices can be. So we went to Humana's website, which is actually a very, very nice website, and went to their Medicare page and just picked two different PPO plans that were kind of in the top of the list. So the first one is their recommended Humana Choice PPO. And then the second one is the Humana Value Plus PPO.
Yeah, and it changes by geography. So this is for Nashville.
Yeah, that's right.
Yeah.
This is for our zip code. And so we were like, okay, what's the difference between these two plans? And the reason why we picked these two is the Humana Choice PPO, which is their recommended one, has a $0 monthly premium. So no monthly premium at all.
Right.
Whereas the Humana Value Plus PPO is $41.40 monthly premium. Again, that's for our zip code here in Nashville. So as we kind of went down, what are the big differences between the no premium plan and the $41 premium plan? The no premium plan has a max out of pocket of $6,700, whereas the monthly premium, the $41 one, has a max out of pocket of $3,000. So that's a fairly big difference if you're going to be using it. We're talking a $3,700 difference. So I think right there, you kind of do the math and you say, if I think I'm going to use this, I'm going to pay, right? I'm going to pay the Value Plus thing. So
yeah, if you're going to have healthcare needs, which if you're a senior, you might expect, depending on your health state,
right?
You're pretty likely to spend $6,000, $7,000 because it costs a lot to get treatment.
That's right. There also is a prescription drug deductible for
the deductible is lower in the free plan, which is kind of counterintuitive to me.
Yep. There's small differences in terms of like the allowance for glasses. It's, you have a larger glasses allowance in the Value Plus plan than you do in the Humana Choice plan. And then there's something here around healthy options allowance where you get like $65 a month. I don't know exactly what that is, but it seems like a kind of a trade. You pay $41 a month in a premium and you get $65 a month in this healthy options allowance. So I think most people, if they have the ability to pay.
Yeah, it's designed to encourage you to pay the $40, $41 a month.
Yeah, I mean, if my parents came to me and they said, hey, Mark, what should I do? I'm going to look at these and pretty quickly go, you should do the one that's $41 a month. Like, it's kind of a no-brainer. You're going to have all these downstream savings. So I think what Bruce Broussard is projecting is that not just Humana, but the rest of the market, in order to deal with a heavy regulatory burden that's going to be continuing to come down over the next 2 years, plus increased utilization, is going to have to increase prices. So that's going to, impact the household cost for these seniors or for the loved ones who are trying to help them out. That's increased costs for the general public from a healthcare perspective, and increased costs for seniors, which every time any bill goes up from my dad, he like freaks out.
Yeah.
Because they're on fixed income.
Right.
He's on his pension plus whatever Social Security is. So increased costs are bad.
Yeah. And I believe I think they can price this based on the zip code. Right. So that's one. I'm pretty sure that they can change the prices in different areas differently.
Yeah, I think they totally can.
And furthermore, recalling back to our discussion with Emily, in some of the rural areas, there aren't that many choices.
Right.
And so, I mean, like everything in life, it probably is going to negatively affect the people that can least afford going from $40 a month to $70 a month. And that, where there is not many other options, Humana is the only game in town. They're a for-profit, publicly traded company. They sort of have to try to maximize their earnings. They're going to increase the price where they can, and where it's super competitive in, I don't know, downtown Miami, maybe it won't be so high. So it's just going to be more pressure on seniors. And then I think it's going to eventually flow through, unfortunately, the health systems that are treating lower income patients are going to then not have
lower margins.
Yeah, right. Exactly.
Yep. Yeah. So difficult times all the way around on the Medicare Advantage front. Higher, the higher utilization and the lower rates that are going to be paid out by CMS based on performance, and the more stringent terms from a star rating perspective. All that is harder for the payer. The payer is going to pass along that difficulty to both the provider and the member. So all the way around, just hard. But I don't know how this is necessarily avoidable.
Biggest Medicare Advantage, and pretty well run. I mean, we know several people up there. It's a pretty well run operation.
Nobody argues with that. I mean, you can't
where I was going to go is there's lots of
high utilization. I mean, that's the problem.
There's a lot of other MA plans that might be in worse shape than this.
Yeah.
So it's going to be a hard industry-wide thing, I think.
Yep. Okay, so just moving to the AI topic and going back to the Davos thing, I think that the most meaningful thing that happened was Argentinian President Javier Milei gave a speech. The speech was kind of lambasting Davos and a general wave of, I guess, left-leaning policies.
What he called collectivism.
Yeah, collectivism. It's interesting. We're really getting into like some very fundamental political discussions now, because people are realizing like just running around and calling everybody a communist is not that effective. So you need to kind of figure out some words, be more specific. But basically that's a masked word it's a soft word for communism, effectively.
But he was painting America in there too. I mean, like
100%.
Right,
100%.
And so
100%.
I mean, I think that's why he didn't use the word communist, because he wanted to include the U.S. and Europe in there.
Yeah.
So,
I mean, listen, I think maybe if I thought the World Economic Forum was more meaningful than it is, I would care more about what he said. And also, if you didn't have this same kind of, rhetoric being projected by our own, Republican candidates, as well as from so many other European and South American leaders. I would say it's not that unique. I think there were two things that were unique about this. One is he's the Argentinian president, and so he did have, the historical backdrop.
They have a lot of experience with this.
Yeah, he did have the historical backdrop to kind of, reflect on how Argentina was this thriving economy, and then, had one of the most incredible run-ups from a currency inflation perspective that the world's ever seen, ever. From a history perspective. So,
and I mean, people should listen to the speech. It's a good speech, and he points out that it is, at least for me, I thought it was good. It is fairly well intentioned when individuals try to bring fairness and let's share across more evenly. But then that's a slippery slope, and it ends up in collectivism. Yeah.
Well, look, I mean, if you're intellectually honest, you have to steelman the other side, and I often appreciate when people who are on the right will at least acknowledge the importance of the left. Like, you need a counterbalance.
Oh yeah,
you need a counterbalance on both sides, right? Because runaway.
That's right. All in moderation.
Yeah, that's right. So anyway. That's not the story.
That wasn't what we were going to talk about. Yeah.
The story is that within hours of him delivering the speech, not in English, this program called Hey Gen that anyone can go buy right now and use to create different AI videos.
I used it for free.
Yeah,
I tested it for free.
Yeah, you can go log on right now. Generated an AI version of his speech with his voice and his speech in English and his mouth saying the words in English. And it happened within hours of him delivering the speech. And it was all over the internet. So everyone could listen to what he said without subtitles and hear it in his actual voice with the tone and all that kind of stuff. And it was incredible. I mean, like, if you didn't know that that's what had happened,
you wouldn't know.
You wouldn't know.
You wouldn't know.
You wouldn't know. Right.
And what's interesting is that's right. And in translation, there always is a choice. Okay, he said this in Spanish or Argentinian version of Spanish. I don't exactly know the right way to say that. I apologize to my Argentinian friends. But he said it in a different language. And
Spanish. It was Spanish, yeah.
They translated it, and I assume because they're trying to show off the strength of their technology that they had the best intentions. But you make judgment calls in any translation. That's why there's lots of versions of, I don't know, the Bible or other things. And so we now are trusting Hey Gen,
of course,
to do this translation.
Yeah.
And I believe they did the best they could, but that is fraught with potential issues.
Well, it's a translation.
Yeah.
It's not exactly what he said.
No, it can't. You can't make it exactly what he says.
Right. So forget about AI hallucinations. It's just remembering a translation cannot be an exact translation. It just it can't happen.
And you could obviously use it to shift the tone slightly in one way or the other.
Slightly, yes.
And even unintentionally, you're going to have to make choices about how to phrase something in English that was in Spanish.
And because his message suited certain people, especially people who are very powerful and get a lot of distribution on X, like David Sachs and Elon Musk, did they put a disclaimer of that at all before they decided to share it out to the entirety of X?
Imagine they would. They just posted it out.
They just posted it out. Like, here's the video of this talk.
Like, this is what he said.
Right.
And and let's assume it is the best attempt at what he said, but it's not actually what he said.
That's right. That's right. So this is,
it's fast. I mean, so it's great that we can understand each other across different languages, different parts of the world.
Oh man, you can imagine traveling, having your phone, having a real-time AI translator where you just talk into it and it just it takes your voice, turns it into the native language that you're trying to speak.
I have that already.
Yeah,
And
that's amazing, right? That's great.
That's great. And when you translate it to media, it is
danger.
Yeah, it's great, and it also makes me a little nervous.
Well, if you are honest and you know that, I mean, look, let's just take the perspective of people that I would say like on the right, which is the world has bad people in it, and that's why you need military and you need law enforcement, because the world has bad people who will do bad things, right? Let's just take that point of view. So people are going to do malicious stuff with this technology to manipulate people.
Yeah, all humans. I mean, not all humans. Humans will always use technology for good and for bad.
Yes. So what's an example of that?
That happened. Yeah.
Yeah. What's an example of that? So the Biden robocall that was happening in New Hampshire with the primary, that was not actually Joe Biden telling Democrats not to vote.
Yeah. And I don't know if you heard it. I heard it. It's pretty good.
Of course it is. We've seen enough of this technology at this point. This stuff
sounds like he's on a cell phone, but it sounds like Biden, and he's saying something that doesn't make sense, which is you shouldn't vote in the primary. But if you just listen to your voicemail, you think, gosh, the president called me and told me not to vote.
And I think, Vic, the thing that most worries me is in almost every setting that I'm in, I am the expert on AI in terms of understanding how far it has come, right?
Yeah.
So when I talk to people and I say, did you know about XYZ?
Yeah. Unless you're in San Francisco, you're the expert.
Most people do not know, unless I'm in
Right.
San Francisco or certain group texts that I'm on.
Yeah. Okay. Yeah.
Right. I'm the person who knows the most. And the people that I'm around know a lot. Right?
Yeah.
So like I'm around people who are knowledge workers.
Yeah. Right.
All the time. All the time. So that's a pretty steep drop off from like the average American who's not working in technology all the time.
just think about the voting population in the United States.
Yeah.
The chance that group of people, the average voter, is not a knowledge worker, and that they don't have a chance to separate real Joe Biden from fake.
They don't because they don't yet understand that these capabilities even exist. That's
Right.
the point I'm trying to make. People, this stuff is being deployed, and people don't even know that there are super inexpensive AI programs that enable it,
Yes.
that are generally available.
They're available for less than $100. You can do the same thing.
Right. That's
And
the part people don't get.
it is not, you don't have to be well-funded or super technology. You just have to decide that you want to sway the election in one way or the other. And this one was so obvious that it got caught.
Yeah.
Okay. But there are going to be hundreds of not so blatantly ridiculous as saying don't
Right.
vote in the primary, but something slightly different, like a slight change in policy that whatever some pollster knows is going to be really negative to Democratic voters. Or it's going to be a health issue or something that is more plausible. And it's going to be on both sides and everywhere. And
Right.
whether you're Democrat or Republican, you should be worried about our ability to have fair elections.
Yeah, so just to kind of wrap this up, I mean, look, when we were talking before the show, I continue to just be concerned about cybersecurity because as we know, the vector of attack is not breaching a firewall. It's not, cracking a password. It's getting someone on the phone.
Social engineering.
It's social engineering, getting someone on the phone and tricking them into doing something they should not be doing because they believe they're doing the right thing.
Right.
Because they believe they're following instructions or following orders or getting, guidance from someone who is not who they're actually getting guidance from. And when you start factoring in AI into these social engineering attacks, with this gap in awareness of these tools, people can hardly pass phishing tests right now.
Yeah. So think about in health systems and payers, it's not one side or the other. How many times does the help desk get a call from a senior doctor or a senior actuarial person, someone with a big title? I lost my password. Can you get it reset? And it sounds, they are confident and they know the right names and they know who you are. They know who your boss. The help desk often is changing that.
Yeah.
And it didn't used to matter because it sounded like the person, or they could somehow try to check on it. But the deep fakes are getting really good now.
Yeah, so, it's super scary. So there's a group called Kodiak Solutions that's an arm of Crow Horath.
Yeah.
And they do a lot of like revenue cycle management stuff and things of that nature. And they came out with a report talking about AI, and they identified it as a top risk for healthcare. And one of the areas was certainly cybersecurity, but another area that they talked about, I think, relates to just sort of this gap in awareness, and I think even like knowing how to feel about AI, which is, okay, let's say you want to roll out automation in a certain part of your organization. I mean, some people just don't like the idea of this stuff, and they're not going to take the time to learn it. And you're going to have to fully replace them. Like, I think there's a lot of, I mean, I'm seeing it in our portfolio, and our portfolio is full of innovative people, but like the work that they do is part of their identity. And the idea of turning over this part of your identity to a machine, like, people have not gotten comfortable with that yet. And so in a lot of cases, to incorporate AI is going to mean trading out teams. It's not going to be as easy as upskilling.
Yeah.
In a lot of cases, you're going to have to trade out.
It's going to be very difficult to introduce a technology that makes the work job much easier, even if you don't cut any staff, because all of the people will see that, gosh, so what am I going to do now?
Right.
Those are all the duties that I do.
Right.
And they will invent ways that they do it slightly better, different, in a unique, special snowflake way. But all that's going to do is delay the implementation. And as you say, it's going to make some leadership teams just like get rid of the whole department and put a new team in. I think it's I mean, we've talked about this before. I think it's similar to when the internet came out, because that's the biggest change that I've lived through. Where like there was a time when we didn't have browsers in the internet.
Yep.
And then 4 years later, every business had it. And there was a lot of resistance during that time of people that were used to doing a thing a certain way, and they didn't like the fact that I could email them and they had the note right then. They enjoyed that 2 or 3 day in the mail process. And it changes eventually, but there's a lot of challenges during that process. And unfortunately, a lot of people lose their jobs, not because there's an intent to get rid of people, but because they refuse to use the technology because they really don't want to learn about it.
Yeah. And I think AI poses a bigger risk of that than the software did.
Much more.
Right. Because
it's much more core to your identity.
Yeah. And also it's just much more existential. The software couldn't operate itself.
Mm-hmm. Yeah.
This thing has the potential in the very near future to operate itself. We're already starting to see some examples of that. So, I think we're just going to have to continue to watch this space when it comes to AI, because it's still the story.
Yeah,
it's still the story of our time. Maybe the story of our generation. I mean, it feels like the world is never going to be the same in so many ways.
Yeah. And we keep talking about it. I think if you're listening, you have to play with this stuff. And it's going to be messy and hard, and you'll make mistakes. And you might, I've bought things that cost me $20 a month that I didn't use, and they weren't that good. You have to invest a little bit of money. It's not a lot of money, a little money to really test it out so that you can understand the impact.
Yeah.
Because otherwise it's just coming.
Yeah, and also like don't go use it and be like, oh, this isn't as good as I thought it was, and then just like forget about it, because all this stuff is getting so much better on a week to week, month to month basis that like it's just something you have to keep tracking. You know, it is early, but man, it's moving fast. It's moving really, really fast. Okay, enough about that. We'll take a break. We will let Doug talk about Jumpstart Foundry. We'll be right back to review what happened with one of the health systems that we talked about in a few episodes back.
Thanks, guys, for the opportunity to talk about our pre-seed fund, Jumpstart Foundry. My name is Doug Edwards, CEO of Jumpstart Health Investors, the parent company of Jumpstart Foundry. We're so excited to be able to talk about early stage venture investing, certainly the need for us to change the crazy world of healthcare in the United States. We are spending 20% of our GDP, north of $4 trillion a year on healthcare with suboptimal outcomes. Jumpstart Foundry exists to help us find and identify and invest in innovative companies that are going to make a difference in healthcare in our country. Every year, Jumpstart Foundry invests a fund, raises a fund, and deploys that across 30, 40, 50 assets every year, allowing ease of access for our limited partners to invest to help us make something better in healthcare. Some of the benefits of Jumpstart Foundry is there's no management fees. We deploy all the capital that's raised every year in the fund. We find the best and brightest, typically around single-digit percentage of companies that apply for funding from Jumpstart, and we invest in the most incredible, robust, innovative solutions and founders in the United States. Over the last 9 years, Jumpstart Foundry has invested in nearly 200 early-stage, pre-seed stage companies in the country. Through those most innovative solutions that Jumpstart Foundry invests in, we also provide great returns and a great experience for our limited partners. We partner with AngelList to administer the fund, making that ease of access not only with low minimums, but the ease of investing in venture much better. We all know that healthcare is broken. Everyone deserves better. Come alongside us with Jumpstart Foundry, invest in making the future of healthcare better, and make something better in healthcare. Thank you, guys. Now back to the show.
All right, Vic, you found this story, Steward Health, which we talked about, I don't know, maybe 15 episodes ago. This is the health system where they have been they have a minority owner, which is a REIT. They've been doing lease buybacks, and they're economically upside down. This story in which Stat is based in Boston, I believe.
Yeah,
is covering what's going on in Eastern Massachusetts. Steward Health has a number of different hospitals in Eastern Massachusetts, and it sounds like chaos is happening there as they are likely going to have to shut down pretty soon.
Yeah, it's a pretty sad story, honestly. That the management team of Steward, it's a for-profit health system.
Previously owned by
Cerberus.
private equity.
Yeah, private equity. Management bought it out of private equity.
Yeah, 2020?
2020, that's right. And since then, they have been selling their buildings and the real estate and then leasing it back from this REIT, Medical Properties Trust, that also owns 10% of the business. But then they use that capital to finance the losses.
Right.
And it's not a well-run business. There's no future. It's sort of the end of monopoly when you start like selling everything.
Right.
It doesn't end well. And yet there's a lot of patients that are, and unfortunately, sort of a repeating theme, it's lower income patients typically that they're serving. And so they're in trouble in Massachusetts. They have several facilities that I think it looks like are going to shut down. It says grave financial distress. And there's no system that I can see that would want to step in or that has talked about stepping in. So I don't know what's going to happen, but it doesn't look like very good.
So things that stuck out to me about this story, one, it's an update on a story we had previously covered. I think the last hospital that they had under management was in California, in that small town that went out of business. And so, this now is on the East Coast.
Yeah.
Very similar situation, except for it's not one hospital, it's several hospitals. The payer mix, 70% Medicare and Medicaid. Now, I've always heard really great things about Massachusetts and their Medicaid program, and it being sort of like groundbreaking nationally in terms of like the kind of coverage that it provides.
Yeah,
and
they're very
offers.
innovative. A lot
Yes.
of access to care.
Yep. So I'm not quite sure how that pertains to rates and how that impacts what's happening here to Steward Health, but it certainly felt weird that this would be happening in Massachusetts, a state that is so well celebrated for the way that they take care of their aging population and their socioeconomically challenged population. So I just thought that was interesting as well. And look, it's just yet another story about these health systems that don't have the scale, and they don't have a payer attached to them, and they have a bad payer mix.
Yeah.
And what is the logical end here? If they don't get acquired by somebody, they're going out of business. And in these communities, that is devastating. It's really bad from an employment perspective, but also like you need a hospital. Okay. Like I didn't even start this episode talking about this, but like, I had a family emergency on Saturday night, and like, thank God for the hospital that was, within, 15, 20 minutes of where my loved one lived.
Yeah. I mean, we're lucky in Nashville. There's great facilities because a lot of them are headquartered here. And if they're not headquartered here, there's a ton of talent here. And so your family member got what I think probably was very good care.
Incredible care.
They're still going through it, but the prognosis is much, much better because of that first 2 hours
That's right.
care.
That's right. And look, I mean, at the end of the day, it's like you think about all the things you're lucky for, and one of them is just like the existence of the hospital, right? Yeah. I mean, that's something we have an embarrassment of options here in Nashville. I mean, it was a decision about where to go, what facility to go to.
Right.
But in these poor, smaller towns, where there is no choice, there is a hospital, and then that hospital is going to go out of business. I mean, this is like, it's just devastating. You can just see story after story of family after family, especially, when they have a 70%, Medicare, Medicaid payer mix. That tells you a lot about the makeup of these communities.
And that doesn't work. I mean, like, that's all you need to know, that the hospital is not in good financial shape.
You don't need to know anything more than that.
Right.
That's exactly right.
And so as a society, I think this is not the first hospital to fail. It won't be the last hospital to fail. We're going to need to figure out, what do we do with these parts of the country where the hospital is not sustainable anymore? And I don't know the answer. I don't think there's a good answer.
No, I agree. We don't have an answer. There's no answer. They just go out of business. There's no one to save them.
Right.
I think this is one of those like let's get out of childhood and let's grow up and let's deal with reality things. Like, Vic, when I was a kid, you couldn't have explained to me that a hospital would go out of business. Because I didn't even see a hospital as a business. I really saw a hospital as something that was part of a community and something you needed, because what happens if someone gets sick? You go to the hospital. It's just like what happens if there's a fire in your house. You have the fire department that they come, and then you grow up and you realize these things are not utilities. They're not utilities. They're entities. They're businesses. And this is, we talk about like single payer. I mean, hell, forget that, man. Safety net hospitals. You know what I mean?
Yeah.
I can't get my head around the idea that we are going to have hundreds, if not thousands, of hospitals just vanish in America. But like, that's what is happening.
Yes.
That's what's happening.
And I mean, I'm a right-leaning free markets guy, right? And I look at this trajectory over the last 15 years, right? And a private equity company bought up a bunch of assets and cashed out and then sold it to a group of doctors who, let's say they're doing the best they can, but they're selling the physical assets one at a time to a REIT, and that cannot end well. And so like that, and we have friends that are in private equity. Private equity does a lot of good But I think there needs to be some guidelines or some control in this, because it's this is not a happy ending story. I'm worried about where the story ends.
Yeah. So anyway, look, I think we need to continue to share these stories just to make people realize, like, especially, I think a lot of our listeners probably live in major metropolitan areas. Okay. For people to realize that there are communities that are losing their hospitals. And, it would be one thing if someone was swooping in and creating freestanding EDs and great clinics and doing a much more efficient job of creating care. I don't think this was happening. I think they're going away, and that's it. Like, people don't have any.
Yes.
They have to drive to the next town now to try to get care.
But this is not in nowhere rural America.
No.
This is Dorchester. This is in Boston.
Yeah.
So
anyway, terribly sad. All right. So last story we're going to cover, I think was pretty cool, because it's a Nashville-based VC that we know very well.
Yeah.
In fact, they have a lot to do with the origin of Jumpstart.
Yeah.
FCA invested in a company called Crowd Health. So joincrowdhealth.com is where you can go to the website, and it's pretty cool. They've created. I'll just read it from the website. Crowd Health is not an insurance company, but a platform and community that empowers you with a crowdfunding tool and a wealth of resources to efficiently manage your healthcare costs. So basically, like, they call it peer-to-peer healthcare funding. And this is like just individuals banding together saying, we got to take care of ourselves.
Yeah.
Because the system's not taking care of us anymore. And so we got to get educated, and we got to create, a community. And we got to support each other, and everyone kind of pay in and help bail each other out, and also teach each other how to I think the most value added part of this is be part of this community, so we can each teach each other how to navigate this system from a cost perspective.
Yeah. I mean, I'm lucky to have some money to be able to pay for things. So if I get treatment, I got value, I should pay for that value. And when I go to any other industry in the world, typically there's a price list before you buy, and in healthcare there's not. And so one of the things they're solving, I think, is that, like, the kind of what is the network pricing for cash pay? I mean, docs don't know. If you ask your doctor, he or she doesn't have any idea what it would cost. They say, call the billing department. You call it. I'm not going to sit on hold and deal with it.
Yeah.
But it is great that once someone does that, then now we know what that price is. And sort of the community can build it up over time. And then it's not insurance, but there is this peer-to-peer support system where, like, I'm willing to chip in, almost like a, it's like a GoFundMe thing or something.
Yeah.
Like, often when you have, it's usually for, like, travel or something that's not healthcare related. If you have cancer or some bad treatment, you got to travel somewhere, they'll do a GoFundMe page, and it's like a charitable way to help your friends. It's like that, except for all of healthcare, and you don't have to be best friends or know them. It's just kind of like, well, they're in our Crowd Health network, and I'll chip in a couple dollars.
Yeah.
And then if I need help, they'll chip into me later.
Right, exactly. So I think it's brilliant. And the reason why we found it is because you found this post on X.
So I'm crazy enough just to sort of follow stuff on X. And it is, this is the CEO, Andy
Schoonover.
Yeah. And he shared a story about a recent experience he had with a hospital bill, sort of illustrating the value of a system like his. But the way it's phrased, it just caught my attention. And then he's got a wrestler, sort of pounding the ropes.
The Ultimate Warrior.
Yes, exactly. And so, it's a new media company bringing a new model to healthcare, which is pretty cool.
Yeah. So the story is basically he goes to the ER, he's fine, but you're going to get your bills from your ER visit, right? And they're not going to come for months. We've all sort of had this. So one of the bills he gets is from a radiology group, local group, and he knows what the CPT codes are, and he gets the final bill, and it's almost $4,000, right? And so he's like, now this is a guy who created this company, right? So he's very knowledgeable about this stuff. So he literally knows the codes, blah blah blah, and he's just like, this feels crazy. This bill I'm getting feels nuts. So he calls that same radiology group's brick and mortar, right? So remember, they were embedded in the ER for this.
Yeah.
So he calls their brick and mortar and asks them, like, what's the cash pay for these coats? And their answer is $1,500. So that's already, more than half off what his bill was. And then he asked, more questions and basically got it to the point where he tracked it down and was like, you guys are gouging me. I'm going to file a suit against you in small claims court, and then we'll just go to court over this. And basically they said, if you're willing to pay by credit card right now, we will bill you $460 instead of the $4,000 that we sent you the bill for in the mail. And I think the best part of this is that he says the entire set of conversations took all of 12 minutes. So 12 minutes to bring a bill down from $4,000 to $460. So obviously 12 minutes very well spent for anybody. I don't care what your hourly rate is. That's a fantastic ROI on 12 minutes. But it requires the knowledge to know how to navigate all of that, right? So,
or the confidence. So the part of the all crowd thing that I really like is you can see, gosh, my peer did this,
right?
And so I'm gonna call and save money too.
That's exactly right. Because a lot of people feel like you don't have any leverage against the healthcare industry, and so I think you're right. A community that's like sharing stories and building confidence in a communal way, in an environmental way. I think there's a lot of, a lot of spillover effect in terms of getting someone who might not have done that before to just take a chance. And make the call, right?
Yeah, the price is not going to go up.
It's not going to go up. That's exactly right. So anyway, I just thought this was a great post that you found, and also a great innovative approach to, like, how do we deal with these mounting costs and hospitals closing and MA going up, and we're going to get higher rates. And to some degree, I think the idea of just banding together as patients and better educating ourselves and better supporting ourselves, I think it's just a really brilliant idea. You're not opting out of the system, but you're saying, gosh, we are better together. If we can share information and share resources, we can help each other collectively go through this.
Yeah, no question about that. And I'm kind of excited about the idea that I don't know how many people have to be in groups like this, right? But it's a pretty small percentage, right? If 5%, 10% are actively pushing and demanding a cash price and then publishing what the results are, pretty quickly someone who's listening in our audience is going to say, well, I run a radiology practice. We should be forward looking. Let's tell people on our website, we will settle these claims for this way and try to be more consumer facing, more consumer friendly. And then the whole system will go. Like once you start to get, I don't know what the critical mass is, but I don't think it's 70%. I think there's some critical mass of kind of like buyers that begin to negotiate and publish things, and then the industry starts to turn towards being more transparent, more friendly, and then it starts to really change.
Well, you just said something that I hadn't put together in my head, but the main reason why I've been bearish on consumerism actually impacting healthcare is because I've just generally felt that the patient is not educated enough to be an effective consumer.
Yeah.
That's been my primary issue with that whole thesis. But you're right. I mean, through community, like if something like this takes off and then there's multiple different companies trying to do it or whatever, right? But if we can get communities of patients together to educate each other and support each other on how to be better consumers of healthcare, then consumerism actually has a shot at changing healthcare. And I think right now it's the only thing that ultimately can, because what we're seeing is even as the government tries to lower the cost, it's going to get passed back to us. As more pressure gets put on health insurance companies, they put pressure on providers. as providers get more pressure, they pass those costs along to the consumer. And oh, by the way,
Humana's raising prices.
Correct. Yeah. Oh, by the way, the payers are going to raise the rates on their plans too.
And it's all, we pay taxes, right? I mean, it ends up in the same, someone's got to pay for it.
That's right. Yeah. So even when the government is quote unquote saving money, the individual household is not saving money.
Right.
So, if patients as consumers are going to be able to improve this healthcare economic situation, I think we're going to need these kind of purpose-built communities. This is, I think it's really cool.
Yes. And I mean, we both have a lot of physician friends, a lot of friends in healthcare and payer leadership. And the individual people, I think, really got into healthcare to make a difference and to help people. And the system has sort of forced them to behave through these different, incentive structures that are misaligned.
Right.
But if we start to sort of rethink it, reinvent it, there's a ton of docs that would love to be more direct, and they need to be paid for their time. But we need to get to what is the fair price.
Yep. Agree. All right, man. Another great show.
Yeah.
Thanks for pulling it together.
On.
I'm headed to Arizona next week. I got HFMA winter.
Oh, nice.
Board winter retreat.
Good. Well, you'll learn a lot about healthcare finance there.
That's what I always do.
Yeah.
2 to 4 times a year, go to these board meetings and learn more than I ever thought I wanted to know from the best CFOs in the business. So I'm excited about that. Hopefully I bring back some good stuff. What do you got next week?
I am going to try to finish this deal in the portfolio I was talking about. Hopefully we'll get that done. And then I'm going to try to escape for a long weekend. My wife has a birthday coming up, so we're going to get away on Friday and take 3 days.
So that's why we're recording on Wednesday?
Yes.
Okay.
Yes.
Got it. I didn't understand that. Okay. Awesome. Well, look, we will see y'all next week. And of course, share, subscribe, let someone know.
And tell us about stories that we should cover. Like if you know a optimistic story or a concerning story, let us know. We want to know about it.
Yep. All right. Till next time.